Hello, this is Dr. Pete, and I'm going to have a basic discussion with you about gynae physiology. Firstly, we need to talk about some structures. There's a special part of the brain called the hypothalamus, which looks something like that, and then not too far away is a pituitary gland, and whenever you draw it, it looks like a scrotum. There's an anterior and a posterior component, and then you have an ovary. And then down here you have the uterus. And in the uterus, you've got an endometrial cavity. And there's basically a relationship between the hypothalamus, the pituitary gland, and the ovary. And we refer to that as the HPO axis. And basically, the hypothalamus releases hormones called GnRH, gonadotrophin releasing hormone, which stimulates the anterior pituitary gland to then release a hormone called FSH, follicle stimulating hormone, and that tells the ovary to make follicles. And if we now look at the life cycle of an ovary, what happens is, if we imagine, I'm just going to draw a bit of a graph here. This here is day 1, which is when menses occur, so that's when menstruation starts. And usually by about day 5 it's gone away. There's something magic that happens around about day 14, and then here we've got day 28 when menstruation starts again. If we look at the way the ovary behaves, so here in the ovary there are a bunch of very small little follicles, about 20 to 40 of them, and they're called primary follicles. And any one of those could go on to be the main event, but we don't know which one it is. By about sort of day 5 to 6, you've now got a dominant follicle of about 1 centimetre. We call that a dominant follicle. And the rest of them are all now, so the ones that didn't make it to the dominant follicle stage are all withering up. And then you have this dominant follicle gets about 2 or 3 centimetres diameter now, and then on day 14 ovulation occurs, and when ovulation occurs, the follicle, inside this follicle is a little egg, and the egg is released and captured by the fimbriae. This follicle then recovers from being ovulated and then turns into a special gland which is all thick and full of fatty stuff, and that's called a corpus luteum. Corpus means body, luteum means yellow, and the reason why that is because if you look at them when they're happening, they look like yellow bodies inside the ovary, and the reason why they're yellow is they're full of cholesterol, because the cholesterol molecule is what forms the basis of progesterone and estrogen. And this keeps going, and then if by about day 25, if nothing's happened, that just withers away and becomes nothing, and the whole thing repeats. So, when the ovaries at this point, little primary follicles are here, there's not much estrogen being made, and so the FSH becomes quite high. Then, as that dominant follicle is produced, it produces estrogen. I might do that in green. So this is a dominant follicle here, and it's producing estrogen, which gives negative feedback. So estrogen, the term is estradiol. I'll just write that down for you. Estradiol, which equals E2. And that gives negative feedback to the pituitary gland. So the more estradiol you have, the less FSH. So something magic happens here at this dominant follicle stage is that as it becomes bigger, it becomes super sensitive to FSH because there's more, this is producing estrogen. It's therefore reducing FSH, so this makes these other ones wither away, but this one becomes super sensitive, and even the minuscule amount of FSH will cause it to continue growing. That eventually gets to this point here, and then about 24 hours or 30 hours before ovulation occurs, the pituitary gland releases another special hormone called luteinizing hormone. There's that word lutein again, luteinizing hormone, which basically is a hormone associated with the corpus luteum. And that is a little peak, which is what triggers this ovulation to occur. And then once ovulation has occurred, the LH then continues, and the LH basically supports the corpus luteum to keep growing, and the corpus luteum now this one here is making estrogen, and this one is making estrogen plus progesterone. If you look at progesterone and you break it up into words, pro means supporting, gest is short for gestation, and O means hormone. So it's a hormone that supports pregnancy, right, or gestation. So that's what happens there just in basic terms. Now I'll just try and draw you a bit of a graph of what actually happens to the hormones. So just get rid of Mr. LH and E2 there for a minute. So if we look at FSH, so FSH is gradually released and then it drops down as that dominant follicle gets bigger, and that's about it. It has its time. That's its moment. If we look at LH, LH is pretty low during this stage, and then about 30 hours before ovulation, 30 hours before ovulation, there's a peak. We call that the LH surge, LH surge, and then it then gradually increases during this part here, and then goes away. If we look at estrogen, there's lots of estrogen being made here in the first part of the cycle, and then it continues on through, and then at day 25, if you haven't fallen pregnant, it then drops off and starts again. And if we look at progesterone, which I'll do in blue, there's no progesterone at all in this first part of the cycle. Progesterone only comes from the corpus luteum. It's the only thing that makes progesterone, and so then it starts to increase, and again, if you haven't fallen pregnant, it drops down. And it's this change, it's this sudden withdrawal of progesterone and estrogen, that sudden drop, which is the stimulation for the endometrium to shed. And some women, before they get a period, can sometimes become a little bit moody or a bit sensitive. We call that PMT, and there's a physiological reason for that, and it's because of a sudden drop in these hormones, which can then result in that sensitivity there. That can be experienced to varying degrees. So that is just a general overview of how the hormones work. Key features are that estrogen creates a negative feedback for FSH, and that this dominant follicle becomes supercharged or super sensitive to the FSH, so that as the FSH is dropping, it still keeps growing. And the other important feature is that progesterone is only made from the corpus luteum, so the only way we can do a test to see if a woman is ovulating is on day 21. We can check the progesterone level, and if the progesterone level has gone up, we know for certain she's ovulated. And if the progesterone level is not raised, if it's still close to zero, then she has not ovulated, and that's how we can tell if this whole system is working or not. Okay.